Good afternoon, everybody. Thank you for joining this Greater Manchester briefing on the ongoing COVID emergency. I'll give you just a brief idea of the running order so everyone can plan the hour in their mind. I'm going to start with an introduction. I'm then going to bring in Sir Richard Lees to give a health update. Richard has to leave at 2:30, so what I propose is that we take health questions between Richard finishing about 1:15 to about 30:30. Then I'm going to bring in Baroness Beverley Hughes to do a police and general update, and then we'll have other questions for the second half of the meeting after that. So just to give everybody that running order. There's a lot to cover, so I'll get straight into it. I've just chaired the 4th meeting of the Greater Manchester COVID Emergency Committee, and I began the meeting by sending the good wishes of everybody on the call, everybody throughout Greater Manchester, to the Prime Minister for a full and speedy recovery. We also did the same for our own Tony Lloyd, who's obviously in Manchester Royal Infirmary, sending Tony and his family our very best wishes as well. Obviously been some difficult news since our last meeting. This week we saw the really sad death of what we believe to be the first care worker in the UK in our own area in Bury, Carol Jamabo. So we all wanted to send our love to Carol's family, thanking her for her service for others. We also have lost a GMP officer this week. And of course, last night, although not linked to this virus, or to a long-term illness, the really difficult loss of the Deputy Leader of Manchester City Council, Councillor Sue Murphy. I think this has hit us all hard, and all feeling quite shaken by the news. Sue served for a quarter of a century on Manchester City Council, known to so many people across the city region. An incredible record of public service, but also I would say leaves behind her a huge legacy of public good. Colleagues might remember she chaired the We Love Manchester Emergency Committee in the aftermath of the terrorist attack. More recently have been working with me on homelessness and building the Bed Every Night scheme. There are so many things I could mention, maybe now's not the time, but we all send our love to Sue's husband, Paul, his family, and there will be a time when we can all take pride in Sue's incredible record of achievement throughout a lifetime in public service. So if I move into the issues that were discussed, very much a practical feel to the meeting this week. And what I'm going to take you through today is a number of the practical steps Greater Manchester is taking to help people through this crisis. Not as much about the government this week. I was making many calls on the government. This week I want to show what Greater Manchester is doing, but there still will be issues that I want the government to address. So we talked a lot last week about protective equipment and testing. So I wanted to give you all an update on both of those topics, starting with personal protective equipment. It remains the case that it's hard to get deliveries out of the national stockpile. Greater Manchester is doing its best, and we have received deliveries, and we understand a new delivery system is coming in this week. But I just wanted you all to know the efforts that we're making outside of the national system to secure equipment that can be used in public services in Greater Manchester, health and social care, but also beyond the health and social care system in policing, transport, in our homeless shelters and elsewhere. And there is really good news to report there. To give you the comparison, out of the national stockpile, we've had just over 3 million individual items of personal protective equipment delivered. Through our own efforts, we've now secured just under 6 million either delivered or about to be delivered. So I wanted to give you those figures just to show that there's a huge amount of effort going on at the Greater Manchester level to get this essential equipment into our hospitals, our GP surgeries, our care homes and beyond, into our homeless shelters, on our public transport and elsewhere. So, big effort from the team. I'm very grateful to them for what they've been doing. It's a difficult market out there because of all the international competition, but we've done well to bring all of that equipment into Greater Manchester. A brief update on testing. This obviously was the main issue on the call last week. Again, some progress, and we thank the government for the efforts to get up and running the new testing facility at Manchester Airport, and that is now beginning to work. I have to say, though, just were some concerns raised from our leaders on the call around the location, because, of course, from Rochdale or Wigan or elsewhere, it's quite hard to access the airport testing facility, and particularly an issue raised by the leader of Tameside Council around the cost of care staff or others accessing that facility and then getting back. So while we are encouraged by the progress, we would say to the government there is a need for more local testing sites so that staff from the NHS or social care can more easily access those sites. But progress to report there. If I turn to business support, we are working hard to support businesses, recognising that many are hitting real cash flow challenges as we get into April. The Greater Manchester Local Enterprise Partnership, the LEP, met on Monday, and working with our growth company and the CA, agreed to release £3 million from our local growth fund to set up a Greater Manchester business interruption loan scheme. Now, this will make available grants of between £5,000 and £250,000 and will fill gaps that the national schemes don't cover. So opening up finance to companies who may struggle to access funding through national routes. It's all part of Greater Manchester's Here for Business campaign, and we'll be putting out further details of this once this press briefing is over. Will be a press release that you'll all be able to see. So that's what Greater Manchester is doing, but here is a call on the government. There's a lot of concern growing here, and I think around the country, about the speed with which payments will be made through the furlough scheme. Many companies will pay their employees middle or to the latter part of April, and as we stand, there isn't clarity yet when those first payments will be reimbursed from HMRC. So a lot of concern building on this issue, and we call on the government to give clarity on it, to give peace of mind to businesses, because it is becoming quite an urgent situation, and that was something voiced by a number of our leaders. I'm just going to touch on one final issue before I bring in Sir Richard. It's a concern that has emerged that I think it's important to bring to public attention, and it concerns levels of speeding on our roads. I hope you can all see a graph that Transport for Greater Manchester have prepared, which should be on the screen now. That graph shows the picture since the lockdown measures took place, and what it says to you crudely is that on our roads now, around 4 in 10 cars are exceeding the speed limits, as opposed to, let's say, 20 or 25%, which would be more normal business. Now, that would be worrying in any event, but it's particularly worrying when more families are out and about taking walks, people are running, cycling, just more people on our pavements. And we wanted to bring this issue to your attention because we believe it needs to be the subject of more debate nationally about what more can be done. The police are stretched, of course, but we will be targeting hotspots. Greater Manchester Police will be targeting hotspots where speeding is happening. We will have a public information campaign about the issue, but I wanted to bring it to your attention so that through your readers and listeners, we can confront people with the facts that people are, I'm afraid, speeding, taking advantage of the less congested roads, but that potentially is putting the public at greater risk. And this issue, I think, needs greater challenge than it's so far received. So I wanted to bring that to your attention, and provide you with that graph, which I think tells a very worrying story. So with that, I will pause my my opening remarks there, and I will ask Sir Richard if he's on the line. Oh, I'm getting a few people shaking their heads. So obviously, Richard having difficulty accessing the call at this stage. So instead, I am going to invite Baroness Beverley Hughes to give her update.
Thank you very much, Andy. Good afternoon, everybody. I thought in my update I wanted to just touch on 4 areas. A whole area of domestic abuse, which is having some attention locally and nationally, and also the wider issue of safeguarding in the home. Some feedback around the work going on food banks and getting food supplies to people. Some comment on waste disposal and the arrangements at the moment and how they'll go forward. And then just a general update on the situation in relation to policing. So firstly, on domestic abuse and wider safeguarding, the safety of children and other vulnerable adults in the home. There is some national concern about this at the moment because, as you would imagine, we're very mindful of the fact that in relation to the stay-at-home advice, people in their homes cooped up together in situations for long periods that they're not used to. Tensions could rise. Also, you know, at the same time, if there are issues like that in the home, then the opportunity to tell other people around, at school, GP surgeries, and so on, all of that is closed down. And it might be that it's more difficult if people are facing those issues, that it's more difficult for them to report what's happening because everybody is together. Despite those concerns, you know, we're not seeing here or anywhere nationally a rise in the reports of domestic abuse. The figures here are stable and to some extent have reduced slightly. Obviously, that's not anything to be complacent about, and we are concerned that what is behind that. Similarly, the referrals of children about whom people are concerned, those referrals into our multi-agency safeguarding hubs have gone down slightly. So we want to pay particular attention to how we ought to respond to that, monitoring that situation really, really carefully, talking to our helplines to try and understand what's happening there, and indeed the calls to our helplines are not going up either. So we're putting in place some arrangements to get some really important messaging out to the public over the next few days and few weeks. And that will be saying really emphatically, look, firstly, if there is an issue at home and tensions rising, there are places you can go to get some advice. If there's a more critical issue of safety in the home and you're really worried about your own safety or those of people who are with you, then it's absolutely the case that the police are wanting to respond to those calls just as they would normally. So the domestic abuse and other issues of safety in the home are a key priority for the police, and we want people to understand that. We'll also be putting some messaging out with the help of some of our local radio stations to get that message out and to give people information about helplines and the way in which they can access the police. Obviously, if it's a critical issue, 999 is the best option. Similarly, using live chat is also a good option. On 999, we're very conscious of the fact that in a really critical situation, somebody who feels really unsafe might not be able to speak on the phone. And I just wanted to reassure people that there are arrangements when people ring 999 to put people, if they're on a landline, if they can't speak, they go straight through to a call handler. If they're on a mobile, the BT operator will tell that person to key in 55. That's a silent solution specifically for mobiles, and it will take the person again straight to a police call handler, where the process of identifying them and getting that emergency response can take place. So that's work that's very important to us, and that's continuing. Secondly, food banks and food supply to vulnerable people. And actually, this just isn't the chronically ill people whom the government have told us about. There's a much larger number of people that all the local authorities and health services are aware of. So the logistical exercise of getting food out to that wider group of people as well is really considerable. 4,000 over food parcels went out last week, organised in the local areas with the help of voluntary organisations. We've had some issues there. There's been issues of the supply of food into those food banks. That is going to ease shortly because of the response of some of the big supermarkets, but there is still an immediate issue in the supply of food, and we're really calling on the public. Hesitate to do this because I know we're calling on the public to help with a number of things such as homelessness, but anybody wants to donate cash or food to the food banks, that would be really gratefully received. There's also been an issue with distribution. Forever Manchester has now received a grant from the National Emergency Trust of £100,000 to help with that. The Mayor and I have matched that funding from Police and Crime Commissioner funding to give each district in Greater Manchester £20,000 now through the voluntary sector to get those food parcels out. We're also hoping for a grant of £50,000 shortly to help provide freezer and fridge storage for those perishable goods that we need to store before we can get them out. So huge amount of work going on there, and it's really, really vital that we can supply food to those vulnerable groups. Thirdly, just a word on waste disposal. You'll be aware that centrally through the Strategic Coordination Group, the waste disposal sites were all closed recently. We've had a discussion today amongst the leaders as to whether there should be some limited reopening of those sites, and decided on balance not, because the problems that could emerge from that would be very difficult to handle at the moment, both in policing terms and in terms of people continuing to obey the social distancing, stay at home messages. However, I think the leaders wanted us to be much clearer with the public that those decisions were not taken locally by local councils, even though they took a lot of the calls from the public to find out what was happening. So we're going to get the messaging much better on that. But for the moment, those sites will stay closed, but we're working with the local authorities to see if they can increase the capacity of their general refuse collection to take up some of those issues. And then just finally, on general policing, demand is stable. It continues to be less than normal. 999 calls are being answered on average at 9 seconds now, so that's within the national target of 10 seconds. 101 calls are about 2 minutes on average. And I'd just like to say here that, you know, it's the OCB, the section that handles the calls, that has been most heavily hit by members of staff having to self-isolate. But we have now, through the benefits of the much maligned IOP system, been able to equip people to take those calls at home. So 20 of our staff are now handling 101 calls from their home, and more will be doing so as we can get the computers, the laptops out to them. So we're really very pleased about that. We're the first police service in the country to be handling 101 calls from home. The staff situation continues to ease a little bit. We're having more staff return now than are self-isolating, so that is helping. COVID incidents last weekend saw a very considerable rise, and I just wanted to mention this. There's going to be some messaging, and I think I want to thank those of you in the media who've been involved in this. I know the Chief Constable is going to be getting some publicity out with your help tomorrow as we go into the Easter weekend. The vast majority of people are really respecting the rules at the moment, and I want to thank the public for that. But there are a minority who were not. And over last weekend, the police were out 500 times a day to incidents that were being reported to them. The first person in Greater Manchester has been charged under the Coronavirus Act 2020 with failing to comply. This is after being encouraged to stop a house party. The guests dispersed and then rocked up again and started to carry on the party. So at that point, I'm afraid that person was charged. So police will use enforcement if they absolutely have to, but they don't want to. They want to encourage people to praise the public who are complying, and to ask everybody, you know, don't congregate, stay at home, and particularly if we get a nice weekend, we've got 4 days bank holiday, please stay at home. So that's it from me, Andy. Happy to take questions later on.
Thank you very much indeed, Bev. I take it we still don't have Richard. I'm just asking the team. Unfortunately, Richard's having technical issues, so apologies for that. What I'm going to do is give you a further bit of my update, then we'll open up to questions to Bev and I, and still see if we can get Richard before the end of the session. I have a fairly significant announcement to make, actually, that I was going to make with Richard on the line, because it regards the NHS. Of course, we are all in awe of what our staff are doing in the National Health Service right now. The kind of dedication, their commitment to what they're doing. It is so difficult out there, and we can see that from some of the TV reports. And like everywhere, we've been wanting to see what more we can do to show we recognise what NHS staff are going through, but also the disruption to their family lives, possibly facing greater costs than they would normally do with the changes, the way the world has changed over the last few weeks. So today at the meeting, I discussed with the leaders a proposal to make the Metrolink tram system free to NHS staff, but actually to do more than that. I was lobbied to do this by a number of Greater Manchester MPs, but actually I want to go further than that, because sometimes the social care workforce is forgotten and doesn't get the same level of recognition. And I want to ensure that we see health and social care as one system. We recognise that they are all on that front line right now, supporting people with coronavirus. Had a report today that there are cases of coronavirus in 83 of our care homes across Greater Manchester, and obviously our social care staff are very much looking after those people. So, having spoken to the 10 leaders this morning, we have all agreed that from Saturday, this coming Saturday, we will make Metrolink free to our NHS and social care staff as a small gesture of thank you to them for everything that they are doing right now. We are obviously going to ask them just to take journeys to and from work, because we don't, as Deputy Mayor was just saying, want to encourage people to make unnecessary journeys, but nevertheless we do want to support people. The government is in discussion with bus companies and ourselves around a package to support bus operators. We know that bus operators in the West Midlands have agreed to provide free journeys for NHS staff, and we would make the appeal as part of any funding package for bus that also the same offer is extended to our bus operators, although I have to say at this stage that bit is not agreed. The only bit that is agreed is the bit within our control, which is the Metrolink system. So that's a commitment from all of us in Greater Manchester, a gesture of recognition to our wonderful NHS and social care staff, to say how much we value them, how much we appreciate them, and we just hope it will go a small way to helping them at this particular moment in time. So that's an update from Bev and I'm taking it we still don't have Richard, so I'm going to open up to non-health related questions, if that's okay, colleagues, and then we will come back to health questions later in the session, with or without Richard, but hopefully with him. But Ross, can I hand over to you then now to take us through any questions that have come in?
Of course. I'm going to start with one from Tom Dambach to you, Andy. We've seen the impact that COVID is having on London transport workers. Could you provide any details about cases, deaths with any GM transport workers, and what support is in place to protect them, to keep essential travel moving? And then just one for Bev off the back of that, or Andy, could we confirm that the GM officer who died, did they have coronavirus? And that's from Hannah Miller at ITV.
Okay, I'll take the first question and maybe pass the second to Bev. So Tom, thank you for your question. Obviously, we keep this under extremely close review, and we are talking to staff at Keolis Amy to make sure that there is protection for people on the front line. The advice that we received, the official advice, was that it wasn't necessary for Metrolink staff to wear protective equipment, because often well, always, unless they are doing revenue protection on the tram, they are obviously within the cab, which is isolated from the rest of the tram. Generally, we've not thought it necessary to issue protective equipment. However, I can say, Tom, that if staff request it, we are meeting that request and providing equipment for those who wish to wear it, particularly face masks. Bev, could I put the second question to you?
Yes, the officer who died was a police staff officer. She worked in the Force Intelligence Bureau and had done for a significant number of years. She did have the COVID infection, I understand. She also had some other health-related issues that contributed to her death.
Okay, Ross.
Thank you very much. I'm going to take one from Niall Griffiths at the MEN for Bev. In the first press conference, ACC Nick Bailey said there was a serious concern amongst officers attending COVID-related incidents without PPE. Do you have an idea of how many COVID-related call-outs the MP had responded to since the first briefing? That was 4 weeks ago. Also, do you know how many shops and businesses have been forced to close that were still operating?
GMP are monitoring that on a daily basis, and at the moment I'm getting overall figures. The figures that in terms of coming out to COVID related incidents, and this isn't a kind of scientific classification. It can mean that an officer's turned up at a large gathering to disperse it. It could mean that they're turning up at a domestic incident, which for one reason or another that officer thinks or is told there's some COVID dimensions to it, and those figures vary a lot during the course of day to day, from about 100 up to, as I say, last weekend over 400 a day. I haven't got the up-to-date incidents on businesses, but the number of calls officers are making to what's classified as a COVID enforcement, which would include those business-related calls, has fallen actually significantly. I'm afraid that's as much as the information I've got on that, Ross, at the moment.
Thank you. Bev, I'm just, while you're there, there's one from Dan Whelan at Police Northwest. He said that the Construction Equipment Association has reported a 50% rise in the thefts of construction equipment in recent sites closed. He's asking, is this a trend that's been noticed in Greater Manchester, and if so, what action to take?
Ross, I'm sorry, you were breaking up to me then. I heard about the reference to the construction industry, but you then broke up a lot.
Apologies, I'll try that one again if you can hear me now. Dan Whelan, Police Northwest, he said that the Construction Equipment Association has reported a 50% rise in the theft of construction equipment in recent weeks since many sites closed. Is this a trend we've noticed here in Greater Manchester? And if so, what action to be taken?
Okay, I think you said that the Construction Equipment Association was reporting a rise in thefts of construction equipment, was that it, from sites? We've not had any significant reports of that. We're monitoring really closely the impact on business, particularly of crime. There's a big concern about cybercrime on businesses for the moment, but I've not got any reports specifically of the theft of construction equipment in Greater Manchester. It may be that it's happening, but I've not had any reports of it so far.
Thanks very much, Bev, and apologies. Hopefully my sound's a little bit better now. Fantastic. Andy, there's two here from you. The initial one is Andy, from Nigel Barlow about Manchester. This one is on speeding, and it's a clarification about the slide we put out. Are we saying that outside of the lockdown, 20% of cars on our roads are breaking the speed limit, and is that doubled during the lockdown? That's from Nigel Barlow at 220. Below that is Tom Dunn from LBC in Hart. He's asked, we've heard questions about hospitals getting PPE from companies who are using 3D printers to make them as the shortage is so great. Is there any guarantee that NHS staff will continue to have access to new PPE you mentioned? Is that something that's been distributed over the next few
Okay, thanks, Ross. I don't know if we can show you the graph again as I answer the first question. So this is a graph from Transport for Greater Manchester. So if colleagues look at it, I apologise, it might just be a bit complicated, but if you see pre-lockdown, so Monday the 9th of March, that you might say would be normal business. The number of trips, vehicle trips, 5 million, and the numbers of cars on the road exceeding the speed limits would typically be, well, you could see it there, between 20 and 25%. So what that shows is, as we've gone into the lockdown, and as things have changed, the number of cars on the road have dropped down quite significantly to around the 2 million mark, and obviously the roads have become much quieter as a result. But what we've seen then is a significant rise in the number of cars exceeding the speed limit. So it did reach 45%, but has just dipped down to 40%. But there's definitely been an upward trend as the roads have got quieter. So that is obviously posing a risk to the public, and it's why I brought it to your attention this afternoon. And I'm hoping that through this press briefing we will have more focus on this issue. Certainly anecdotally, I notice a greater number of speeding cars on the road, and the worry is, with so many people out taking exercise and the pavements more crowded than normal, this poses extra risks to public safety. So it's an important graph, I think. We'd be grateful if people could replicate it, because it tells its own story, and it's an issue that needs some focus. Ross, sorry, the second question?
Second question was from Tom Dunn, LBC in Hart. It may be one that would be directed at Sir Richard, but it's about hospitals getting PPE from companies using 3D printers. So 221.
Yeah, thank you. It's an important question. Obviously, everybody is looking at every possible way of getting equipment. As I understand it, our hospitals have not had to do that, although I stand to be corrected, but I've not heard that that has happened. I know some of our schools have volunteered their 3D printers, and that has been used to create a kit. Whether that has been actually used or not, I couldn't tell you. The reason I gave you the figures at the beginning is because Greater Manchester has initiated its own substantial initiative to source PPE equipment from around the world. And the figures I gave you of just under 6 million items purchased, either delivered or about to be, is a significant number. I can say as well, though, there are a lot more in deals that have been done or are about to be done. So it's quite a conservative figure that I've given. Because of our efforts and what our hospitals had been doing anyway with regard to making sure that they were sharing equipment across the system, I think our hospitals have managed to this point, but it remains a very severe ongoing challenge. And we hope that the new national delivery system will start to ease some of the pressure and get more PPE into the NHS, social care and other public services frontline.
Thanks, Andy. I'm just going to take two questions on a similar topic about social distancing in workplaces. The first one's from Grace at Revolution News at 221. What's the latest guidance regarding businesses remaining open, even if they can't implement social distancing measures? And she's reporting that a number of listeners from Oldham, Rochdale and Tameside are working in these workplaces and are fearful for their health. They're keeping their jobs, their bosses are telling them they must come into work. And then Niall Griffiths follows that up with, have we had any response from the government regarding your joint letter you sent with the Mayor of the Liverpool City region?
So I'm not aware of a response received yet. And Steve Rotherham and I wrote on this issue this time last week. So I will chase that and issue it if there has been a response, but I'm not aware of it having been received as of yet. It is an ongoing concern. We have received just under 1,600 individual complaints from employees, not just in Greater Manchester, around the country. And the complaints are about the non-observance of the guidance in workplaces, not just distancing, but supply of sanitizer or hand washing facilities. So what we have done is initiate a process of dialogue with the organisations mentioned in those complaints, certainly the GM-based organisations. But of course, we can't do this for the whole of the country. I believe there's been some who've responded positively to our requests to more closely follow the guidance, or if we were able to explain the guidance more clearly to them. But we've opened up that ongoing process of dialogue, which I think is the right thing to do. We're not helped by the weakness of the national guidance, which talks about the 2 metre distancing being observed, quotes, where possible. And it's that get out clause that continues to cause me a great deal of concern, and I don't think is sufficiently robust. And so we have raised that concern with government. We will update you all as soon as we have a reply, but you are right to say it's an ongoing issue.
Thanks, Andy. I'm going to go to Amy Walker at The Guardian. There's one part for you and one part for Bev, so I'll take the part for you initially. Last week, you'd said that Greater Manchester universities were offering up staff laboratories and chemical reagents to help ramp up efforts to make testing kits. Are we aware of the government taking up that offer? And for Bev, the first part of the question is, do we know how many GMP officers are currently off work due to contracting coronavirus or because they are self-isolating, and what percentage of the workforce they make up? Go to Andy first.
Well, the offer still stands, and not as yet, although I was encouraged to hear the Health Secretary talking last week after the briefing that we had given, saying that he wanted to work more with university and industrial partners. The feeling on our phone call, Amy, this morning, when we discussed this issue, was that the national approach to this, where it's been introduced without a great deal of consultation, it has to be said, but I understand the need for speed. But however, I don't think we did feel particularly consulted on the airport facility. The problem, of course, with that is it misses some of the opportunities that might be there around Greater Manchester. And the view on our call was that there are resources in Greater Manchester that could be unlocked if we had more local ability to shape the way the programme is working. And there was that call for more localised testing facilities, using some of the capacity within our hospitals. So we will remain in dialogue with the government on this issue. As far as I understand it, there is no national agreement on an antibody test at this stage. So it's hard to see how, from where we are today, we get up to the 100,000 tests a day by the end of the month. But I would repeat the offer that we stand ready to help in any way that we can.
Hi Ross, thanks for that question for Amy. I haven't got those figures, the most recent figures to hand. There will be a summary coming to me later today from the latest gold meeting at GMP, and I'll have those figures then. But the only figures I've had are a bit out of date now, so I won't use those. Thanks.
Thanks very much. We can follow that one up with Amy. I'll go to people who haven't had a question answered yet. So I'll go to Kevin Fitzpatrick at Radio Manchester, who's asking, Andy, what is the latest on homelessness and rough sleepers being housed in hotels? And I'll also take a question from Jen Williams at the MEN. They're still getting reports of care homes being told that residents will not be admitted to hospital as a matter of policy. This has come from care home providers, amongst others, and there clearly remains considerable concern about this within the sector, despite reassurances for government. What is your understanding of the guidance in this respect, and what is Greater Manchester's policy on that? That's Kevin and Ben.
Thank you both. Two important questions. First, Kevin, on your question. It's a challenging picture, as you might expect, and we are constantly working to bring on stream new capacity. But as of today, we have around 630 people accommodated under the scheme which we introduced. One of the challenges we have is getting enough staff to the sites that we're using, and we're working hard at that. we are also working hard through the Greater Manchester Mayor's charity to get packages of support for people who are in accommodation. But we've been refining our processes over the last week with a greater spread of locations across Greater Manchester, and I think the exact figure, will correct this if it's wrong, but I think 628 people are currently in accommodation as a result of the capacity which we unlocked a couple of weeks ago with the £5 million. Jen, you raise a really important question. It's one that's been troubling me, and I've been doing some further work on it together with Sir Richard over the last week, and it's a shame he's not here to speak to it, but I will speak to it, and then maybe, Ross, in what remains of it, go into more health briefing so that colleagues can ask any health-related questions. So I heard this report. I had a complaint submitted to me last week from somebody in the Tameside area saying that an elderly resident of a care home who needed to go into hospital with suspected pneumonia was told that there would be no admissions from care homes, and there was a suggestion that it would be more appropriate to look at an end-of-life pathway, which caused a lot of anxiety for the family concerned, and of course caused anxiety for those who heard about that. There have been other reports in other parts of the country, GPs practice in Wales sending a letter on a similar theme. Further to that, one of our MPs raised with us a concern that cancer patients had treatment stopped. Now, all of these were unconfirmed, but they were very serious points which we have been exploring in detail with colleagues at the Greater Manchester Health and Care Partnership. What I can say is actually quite encouraging and reassuring in response, and that is there are no such protocols in place either at a national or at a regional level where there is a denial of necessary hospital treatment to anybody who needs it, and that goes for people across the board. It's the usual that applies, which is clinical judgments being made on what is in the patient's best interests, of course, with some acknowledgement of the greater risks they may face with coronavirus, and particularly coronavirus within a hospital setting. But I want to confirm this today, and I'm really glad you've asked the question, that there is no change to policy, and there should not be a fear amongst people with disabilities, parents of children with conditions like cystic fibrosis or others, that there is some sort of secret blanket ban in any way on the provision of treatment. We've been reassured that that is not the case, and later today I will issue a statement on this matter from Sarah Price, the Chief Officer of the Greater Manchester Health and Care Partnership, to that effect, to make it absolutely clear to patients who may have these worries. From there, I think, Ross, I'll go into a broader NHS update. It's a challenging picture out there. The leaders this morning were given an update, a data update from across the Greater Manchester Health and Care system, and if I could just share with you one statistic from that, which I think is relevant. At last week's meeting, we were told that the number of daily hospital admissions for COVID-19 in Greater Manchester was running at around 25 per day. As of yesterday, that had increased to 52 per day. So that gives you an idea of what is happening across our city region. Hospitals have obviously taken steps already to create spare capacity given that rate of increase. And as of today, we believe our hospitals are running at 56% capacity across the system. Overall, there have been 2,263 confirmed cases of COVID-19 in Greater Manchester hospitals, 279 deaths in hospitals. So a very challenging picture. On a more positive front, can confirm today that the new Nightingale North Hospital at Manchester Central will be opening this weekend into early next week. I think the exact day is yet to be confirmed, but we are expecting it to be over the weekend or at the very early part of next week. And of course, that represents an incredible effort on behalf of those who've been constructing the hospital on that site, and we pay tribute to them all. So that should give people extra reassurance that there is hospital capacity should people need it. Ross, but I'll hand back to you to take any health questions that colleagues may have.
Andy, could I just come in there before we do that? Because I know one of the things, if you remember, that Sir Richard wanted people to know about was that in relation to primary care facilities, there are now what he called hot and cold facilities, which means that people needing to access the doctor without a COVID-related set of symptoms did not have to be concerned about going to a surgery because they might be mixing with people who were going for those reasons. There are now some dedicated places for people to access GP support with COVID symptoms, and that those two groups of patients won't have to mix.
Thanks, Bev.
Yeah, so I don't have any other specific health questions through, but I'm sure they'll be coming through at the moment. But there's a few outstanding ones from people who haven't answered.
Okay, and if I answer those, Ross, and then take any health questions as they come in as I'm speaking.
Yeah, no problem. So Adam Higgins, the Tameside Reporter, he's asking what plans there are for support for local newspapers throughout the city region to make sure that they still operate, are financially viable, and staff are not furloughed. And one from Kevin Fitzpatrick, I think you and Bev will probably want to speak to, which is, what is your message to the public on staying in during the bank holiday weekend? And Bev, will GMP have extra officers on shift to disperse groups if need be? That question from Kevin's at 2:35 PM.
Ross, was the first question on newspapers?
Yes, it was.
Yeah. I mean, obviously, I recognise how tough it is anyway for local papers, how crucial they are in this particular moment that we're living through. But also kind of know now that there'll be extra pressure on papers to furlough staff, and I know some of that has been already happening. I would make myself available to speak to any newspapers in this owners in this period, because the public information side of things is crucially important. And if I could make the offer through this briefing to kind of pair up anybody with our growth company to see if the new scheme we've announced today or any of the other support available at the GM level might help, then we're more than happy to do that, recognising the importance. Obviously, of course, there is public advertising that may be being placed, and I will reiterate the message across our system that as far as possible we should be supporting our local and regional media, newspapers particularly, in this moment. On the staying in point, shall I take that? Well, I'll hand over to Bev as well, because Bev mentioned the rise in house parties last weekend, which is not what we wanted to see, and also the first prosecution for somebody involved in one of those gatherings. And we can, both of us, reiterate that there'll be more of that if we see any repeat this weekend. It's an opportunity for me to flag the United We Stream service, which is obviously intended to keep people in their home. We're putting on an amazing array of GM cultural delights via United We Stream, and this weekend we have a very full weekend coming, all done from people's homes, completely in accordance with the guidance, and we all are fully anticipating the Hacienda all-day event on Saturday, which should be an epic event, linking up with other streaming services around the world. So hope you'll all be publicising that, as well as encouraging people not to go to house parties, but to stay in their own home and enjoy that particular Greater Manchester cultural delight. Bev, do you want to add to that?
Well, I know not everybody's got laptops and things, but for those that have, I'm having a Zoom party with my kids and grandkids tonight, and we're all eating together and we're looking at each other across the laptop. So there are other ways of doing it. I would just say this though, Sorry, it's me. It's my doorbell's going. Hold on a minute. You see, staying in and not contaminating anybody else, helping to stop the spread of this disease, is our contribution we can make to change the course of this illness from what it would otherwise be. So whilst the nurses and the doctors and the shop workers and everybody is doing all of their bit to get us through this, this is our contribution, you know, because if we do stay in, there will be less people admitted to hospital, less people dying, and the health service will be more able to cope. So it's in our hands to change the course of this illness by staying in, and that's my plea to everybody. Please understand that this is us doing our bit by staying at home. I know it's tempting, you know, ordinarily we'd be seeing our families over this weekend, but there's other ways of doing that, and we just need to respect the restrictions, as most of the public are, and I do want to thank them for that. Most are, but where people aren't, you know, we will initially encourage them to do so, and if they continue to not respect them, then we will enforce the law. Thanks, Ross.
Thank you. I'm just going to jump to a couple of health questions that have come in. So apologies to those people who've submitted questions. I think it's important we take health ones. Andy Bounds at FT has asked, how big is the increase in the critical care bed capacity in Greater Manchester? London hospitals are aiming for a 400% increase. And how is Nightingale staffing going as well? Jen Williams asks, what is the situation with ventilator use currently? Last week, Sir Richard said that 31 people were on ventilation out of around 475 who were in hospital. Is it possible to get a straight comparison with those figures? How will we to follow up?
Ross, I don't have those figures immediately to hand, but I will supply them after this briefing. But what I can say in general terms is, I mean, colleagues saw the hospital occupancy, or note the hospital occupancy figure I gave earlier, and that also applies to intensive care facilities. So there is spare capacity within our hospitals in intensive care, and also we have the Nightingale Hospital coming on at the weekend. Now, I just want to mention something that I think is an issue that colleagues just need to have an eye to. And what we are finding elsewhere is it's not necessarily a shortage of the ICU capacity that's the issue. There's a growing concern around oxygen availability, and that's something that I'll be turning my attention to. It's often the case that patients need access to oxygen, but not necessarily ventilation. So the position the Prime Minister is in is apparently a common position with this condition. So we are giving a good degree of thought to that particular issue. Obviously, ensuring we have enough ventilators is critical, but so is the supply of oxygen in our hospitals, in our care homes, and in other settings. And that would appear to be a very significant issue from other parts of the country, and is one which we're looking at very closely. But I will supply the specific figures, Ross, following this briefing.
Thank you very much. I'm just going to take two questions to probably bring us to the end of the session. Hannah Miller at ITV asks, so on warehouses, they've highlighted the case of a blind worker with asthma who's been told he should go to work or take unpaid leave rather than be furloughed. In your view, is that correct? And also, further to that, Dan Whelan from Police Northwest asks, what is the latest on construction sites? Should they be closed, in your opinion?
Well, this remains a very challenging issue, and personally, if I had been making this call in government as former health secretary, I would have erred on the side of caution with regard to workplaces and taken a firmer view on non-essential work, because we are in the middle of a global health pandemic, and in my view, health comes first. I fully understand the economic issues and the concerns about economic recovery, but in this instance, protecting lives comes before protecting the economy. That said, the government didn't go with that, and I think the same point was put over by Nicola Sturgeon and Sadiq Khan. So that being the case, given that businesses are allowed to open, we've been then calling for enforcement of the guidelines with regard to hand washing, sanitizer, and safe distancing. And it's the weakness in the national guidelines that still give me a major cause for concern. And I would say it again, they should remove the ambiguity in those guidelines so that everyone can feel safe at work. I am aware of the case that was raised by Granada this week. I think it's unfair for staff to be put into that position where they have concerns about their health, but then are also fearing losing their job or being without pay for a considerable period of time. And my appeal to the company concerned, but indeed any company, if staff are asking to be furloughed in this situation, then I think that is the fair and reasonable thing to do, recognising that business isn't what it has been, and I think that's something that they should be doing. The furlough scheme is there for that reason, to allow businesses to wind down their operations, protect their financial position, while at the same time giving security to their staff. And I would like to see more companies taking advantage of that scheme, particularly where there are concerns that they've not been able to put in place the necessary support in the workplace. Nobody in this moment should be worrying about choosing between their job or their health. It's not a fair choice to put before people. And I would call on all employers in Greater Manchester, who I hope will be what we would call good employers, responsible employers, to think about their workforce in this moment and to ensure that they have that ability to either work safely or have peace of mind that if they are not to be at work, they have financial security. Ross, is that it for today, or is there anything else to cover?
There's a couple. There's one or two. I think a final question we'll take from Tom Danbach at Hits Radio. He's got a question about pollution levels, and we've seen big falls in pollution levels. What's your reaction to that? What is the thinking amongst leaders about the impact normal traffic has, and is it changing thinking about what we can do after the lockdown? That's a question from Tom Danbach at 2:35. That'll be the final question.
It's a good question, Tom. I mean, obviously, I was pointing to the effect of speeding as a result of lower traffic levels, but there is obviously a beneficial effect, which is cleaner air and less noise, particularly for people who are living in our more densely populated areas. As we look to the future, it is possible to see some positive change, isn't it, that comes from all of this in terms of the way people live their lives. Certainly, I've noticed fewer transport complaints coming through to me on a daily basis. I think we've all discovered that it is possible to have an event like this over a digital means as opposed to always being face to face. And I hope that one of the things that we can finally secure is a change to the working day in Greater Manchester, so that there's less of a rush hour between 7:30 and 9 and then 5 till 6:30, and we can use these new systems to get people a more flexible start and end time to the working day, so that we can manage those congestion issues. In terms of the clean air debate going forward, one of the calls I'll be making on the government with other metro mayors is for funding to be accelerated as a fiscal stimulus coming out of this to enable people to switch vehicles to cleaner vehicles. That is an obvious thing for the government to do coming from this, so that we can accelerate that journey towards clean air, as well as giving a bit of financial support to our van drivers, taxi drivers and others. I hope that there is a lasting legacy with regard to levels of physical activity. I'm sure all of you in the media are living a very healthy lifestyle right now, watching what you drink and eat and getting out there every day, as the Prime Minister has asked you to do your one piece of exercise. I hope you're all doing it. Obviously, it's of course a safe way to travel right now, particularly for essential staff. So I hope there is a legacy here for our ambitions to get Greater Manchester moving, and that more people will go walking, running, cycling on a daily basis, even travel to work by those means. So these things, I think, will come in time. But I would certainly make the specific call on the government to get in place a financial package now, so that our taxi drivers, our van drivers, other vehicles can switch to clean air, so that we keep the benefits of what we're all experiencing right now. With that, Ross, I'm going to just finish by thanking colleagues in the media for the way in which you continue to report this crisis. I think the standard of reporting is extremely high, with very good information being given to the public, the right balance being struck between challenge and clear information. And so I'd like to thank you all for that. As you've heard today, Greater Manchester is doing what we can. More support for businesses has been announced today. Our own efforts to bring in items of personal protective equipment for our frontline staff, and I'm very proud of what we've done on that front. More support for our food banks that the Deputy Mayor has announced, £20,000 per borough going straight into those food banks in our communities. And of course, from this Saturday, free travel on our trams for our NHS staff and our social care staff. So as we thank them again tomorrow evening, you know, I would just want to say it's a small gesture from us, beyond the clap, beyond the claps that we give them, to recognise what they are doing at this particular moment in time, and we are so grateful to all of them. So Greater Manchester is doing what we can. We are continuing to review everything to support people through this difficult time, and we will get through it. And yes, the difficult days may just lie ahead of us now, but we believe, as I said last week, we are in a strong position to face what is coming, as well as supporting our people and our communities. Hope you get something of a restful weekend, colleagues. Thank you again for tuning in, and we will see you all this time next week. Thank you very much.